Welcome to On The Beat, everyone. I'm over here with Dr. Griffin from Griffin Centre of Oral and Maxillofacial Surgery. And of course, one of his fantastic patients and a great success story, Dr. Mike Freeman. And of course, we're talking about Inspire. Welcome to the show, both of you. Okay, let's talk a little bit about Inspire and the system and why we use it, Doctor.
Well, it's a system for treating obstructive sleep apnea for patients who cannot tolerate the CPAP mask, and it's a system that is placed in a way that as you breathe, it stimulates a device that stimulates the tongue to move forward and open the airway.
All right, so it is surgery. Well, we want everyone to know that because it's completely different from the CPAP machine.
Yes, totally.
All right, now, Doctor, I love that we got another doctor in as well who's been a patient and had this process done. You were using CPAP, correct?
I used CPAP for over 20 years.
And why did you decide to change? What was the feeling on CPAP? You hated it.
I hated all 20 years.
Okay.
I tried as many different masks as I could. None of them were acceptable. You know, if you don't maintain a perfect seal with the mask, it blows on your bed partner.
Yeah.
And you wind up with an unhappy wife.
Unhappy life.
And
Empty bed.
And an empty bed. Now, I do want to say very quickly what happens. You were dying 45 times within an hour every hour.
on average.
On average.
On average. And it's stopping breathing. And it's what you do is way worse than snoring because when you have an apneic episode, your body doesn't like that and wants to start breathing again. And so what you really do is you're gasping for air, and you sound. My wife and my daughter call me the boar hog because of the terrible noises I made.
Well, Dr. Griffin, is this the average that you hear this type of story? You know, dying up to 48 times.
Yes,
an hour? This is what people are experiencing?
It's a serious condition. It can lead to high blood pressure, heart damage, dementia. It's a very serious condition that really needs to be treated.
All right. How did you feel before you actually had this surgery and had Inspire implanted?
Tired.
Yes.
Because you're not sleeping well at all.
Yes.
You don't get into REM sleep, so you don't dream.
Right.
And that's a part of our life that's important to dream. The hypoxia sometimes would lead to waking up with a headache because the brain is not getting all the oxygen that it needs.
Right.
So basically you feel awful.
All right. And exhausted 24/7. Now you've had the surgery. How are you feeling?
I feel great.
Really?
I went from 48 times per hour on average to 4 times per hour.
People sitting at home, I want you to tell them if they're skeptical. What do you say to them?
If you're skeptical, this is outpatient surgery.
Yes.
You don't have to spend the night in the hospital. The surgery is very simple. It's 3 incisions, 1 to slide the device in, 1 to get the right nerve wrapped around, and one for the diaphragm.
Right.
They prescribed pain pills, but I didn't take any. I had no use for pain pills.
Okay, now at night you turn it on.
Yes.
With a remote. Where do you put the remote?
I hold the remote close to the box, and turn it on. It's a very low power remote.
Yes.
And I usually joke that that's so my friends who have one can't yank me around.
Okay. So what is the downtime for having this surgery?
Just days. You're going to have swelling,
right?
And it's an easy procedure for the patient, but surgically it's a highly technical procedure and requires the Inspire people to be there. We test the branches of the nerve. They monitor the readouts of the muscle action and everything. It's a very, very highly technical procedure.
All right, if you want to find out more information about Inspire and, of course, Dr. Griffin, there it all is up on the screen for you. Griffin Centre of Oral and Maxillofacial Surgery. Give them a call.